It's Wellness Nerd Out time! How you guys doing tonight? Happy Wellness Nerd Out time, you guys. And today, we're going to finish our discussion on duck feet. We're going to talk a little bit more about some of the complications we can suffer as a result of duck feet, and we're going to talk about what you can do about it, most importantly. So, to pick up where we left off, we said duck feet, either 1 or 2 feet. You're walking like this, right? And you have that foot that's pointing out, and what happens is your foot becomes flatter and it's hyperpronated. So you're sitting on it like this all day, right? You're walking like this, you're walking like this. And this abnormal stress, it causes the intrinsic muscles of your foot to take time off because they're responsible for keeping that arch. And when we have that arch, we can absorb shock when we're walking, right? And so when we don't have that arch anymore, we have to do other things in the body to compensate for the fact that we're not absorbing shock properly and not proprioceptively communicating properly with the foot and ankle to make sure that we don't fall down, right? That our leg doesn't give out, right? And so what happens as a result of that? Well, in addition, right, aside from having these flat feet, one, the extrinsic muscles of the foot have to work harder, we said. The ones coming down the front, right, of your leg here and then attaching and inserting onto the foot like a tibialis anterior or extensor hallucis longus, for example, right, like we said yesterday. But also what's happening with the tibia is it's internally rotating, right? So now picture this is twisting this way, right? So it's twisting that way, and then what happens is your femur, your thigh bone, is twisting this way to compensate because it's trying to balance on itself to stay stable, right? So now you have that in, you have this out, and what happens? Well, you have extra stress here at the knee joint, and these ligaments in your knee aren't used to being stressed in this way with such consistency, right? And the MCL, we know, runs down the middle here, right? Going from the femur to the tibia, attaching medially, and it's not used to, or at least it is taking excessive stress, we could say, when it is being twisted. Right now, there's some torsion on it, unnatural torsion for prolonged, consistent, time periods, right? And the MCL is attached to the medial meniscus in the knee, right? And so this increases your risk for injury in the knee, and specifically, in the ligaments of the knee, in the MCL or the meniscus, right? And it's less stable. And this, not to mention the fact that some of our deeper ligaments, our anterior cruciate ligament and our posterior cruciate ligament, right, so-called because they cross, the ACL and the PCL, right? Well, they move in this sagittal plane, right, with flexion and extension of the leg, right? And so they aren't also comfortable with, prolonged periods of torsion, right, at the knee. And so this twisting also stresses your ACL and PCL, and it can cause increased risk. It can lead to increased risk for you rupturing or injuring one of those as well over time, right? So real serious. And not to mention that your pelvis is now anteriorly rotating. And why? Well, because you're recruiting these external rotators of the hip, these deep external rotators of the hip, like the superior gemellus, the inferior gemellus, like the obturator internus, I believe, right? I'm trying to remember back to gross anatomy 1, and the piriformis, right? We all know as the sciatic nerve pierces it, right? And so with this, we also can get sciatic pain a lot, right? Because if it pierces the piriformis, and the piriformis is overly tight, it's crunching on it, it's constricting the sciatic nerve that pierces through it, right? And so it's not uncommon to have some pain from here, the low back coming down the leg a little bit, right? And now if we're using those muscles, those deep external rotators of the hip, to maintain stability and to prevent the leg from giving out, what we're not using are our glutes, right? And if we want to strengthen the glutes, we're going to want to strengthen the glutes, I should say, right, to compensate for that fact. And so this is all well and good, or at least all interesting, but what can I do about it? Here's what you do. Take off the shoe and show you. Not even trying to rhyme, I'm just working out. So you take one is you have a golf ball, and I'll take this one off too. You have a golf ball, which I don't have right now. I don't even play golf. I would like to try it. But you have a golf ball under the balls of your feet, right here, under the ball of your foot. And you're gonna roll it side to side, side to side. You're going to roll it front to back, under your foot, front to back, putting pressure on it. Then you're going to place it under your first metatarsal phalangeal joint, under the knuckle of your big toe, really, right? So you're going to be on that, on the knuckle of your big toe, on the bottom of it, right? And you're going to dorsiflex your big toe. You're going to dorsiflex the big toe, dorsiflex the big toe. And it's really interesting, and you're going to do the rolling with the golf ball for like 3 minutes, and you're going to dorsiflex 15 times. Do a few sets of that. You could do 2 sets, that would be great. It's interesting because a lot of you are probably thinking, right, well, that sounds a lot like something I would do for plantar fasciitis. Well, no kidding, you know, because what happens when we have overpronation of the foot here, like we said, the intrinsic muscles are weaker. They're not working as hard. We get this flat foot, those intrinsic muscles of the foot, that is, right? We get these flat feet. And so what happens is we're putting excess stress on the plantar fascia on the bottom of the foot, right? Connecting from the heel to the more distal portions of the plantar surface of the foot, right? And so now we have them, it's stretched out, and you know, this can cause inflammation of the sheath and things like that, right? So the plantar fascia, and so you know, rolling it out is generally a common treatment for that, right? We get that as a result of duck feet much of the time, right? So it's why they kind of seem like similar treatments, if you're wondering. Another thing that we can do at home, right, is we can plant our foot and not like this, keep it pointing forward, right? That's the whole point. We're trying to, you know, fix this whole problem. And you're going to squeeze your big toe and pinky posteriorly towards your heel, while you squeeze your heel towards your toes. You're trying to make an arch in your foot. You're trying to make an arch, make an arch. While you're doing this, you're going to rotate your knee. You're going to rotate this way, outward, right? To counteract the internal rotation at the tibia, strengthen. We're going to hit that vastus medialis a little bit, right? Which we don't recruit as much when we're walking around like this, right? And so you're going to pull big toe, little toe to the heel. 1, 2, twisting the knee, rest. Again, 1, 2, twist, rest. Again, 1, 2, twist, and try to keep your foot flat on the ground while you're doing that, right? So another thing we can do, because we said that one of the big problems here with duck feet is the fact that our glutes are not working. They're not contracting a lot, right? We have overly tight external rotators of the hip, and we have weak glutes, right? And so to isolate them, what we can do, I hope you can see like this, we can take our feet, and this medial or middle, we could say, right? Plantar surface of our feet. The plantar is the bottom we plant on, right? So right along here, we're going to touch that part to the other foot, right? Like this. Now you're going to pull it. You're going to pull it up to your glutes, high as you can. Pull it up to the bum, all right? And then you're going to take your hands and you're going to place them on your hips and on the ribs here. And this is kind of, you know, where it kind of helps you feel the range of motion you should be getting when you're doing a glute bridge. Now you're going to let your legs come out, up, down, up, down. What you don't want to do is this. Use your whole back. Isolate them. You'll feel your core contracting a little too when we have our hands here, you know, and we know we're kind of doing it right than if we're going like this, right? But you keep them wide. See, I naturally let mine come in because you know, and you squeeze them together like so. All right, I think we did enough demos. My legs are really sore from the leg day yesterday. So that's what we got for you guys. If you have any questions, if you want to talk about any other topic related to anatomy or anything like that, any sort of issue you have going on, whether it be with gait or musculoskeletal in general, anything like that, let's talk about it. I would be happy to. Who do we got? Zach, what's up, man? I love you. Johnny, hey, man. What's up? Love you, too. Danny Saltis, this is a party right here. 3 stud muffins on. Baked Georgian, hey, how you doing? Thank you for hopping on. I hope you got something out of that. Hope you enjoyed it. So I also hope you don't have duck feet and you don't need that information. But if you do, there you go. Thank you guys very much. Have a great rest of your night. Happy Wend Wellness. We'll see you tomorrow. Thanks.